Good afternoon, everybody. Thank you for taking the time to attend our Lunch and Learn event today on training grant opportunities through West Michigan Works. My name is Trevor Muir, and I'm the Industry Council Lead for the West Michigan Health Careers Council that's run through West Michigan Works. For those that are unfamiliar, I'm just going to spend a few moments giving a high-level overview of West Michigan Works itself and the West Michigan Health Careers Council. Following that, I'm going to pass the virtual microphone over to my fantastic colleague, Tori, who's going to share some valuable details regarding grant funding opportunities available to you as employers. So West Michigan Works is one of 16 Michigan Works agencies across the state. So our agency serves employers in the 7-county region seen here on the slide that kind of encompasses a good chunk of the West Michigan region. West Michigan Works itself is comprised of kind of 3 main focus areas. So there's retention solutions, talent solutions, and business solutions. Today, we're going to be focused on the training grant piece and the employer part of the organization, which is our business solutions team. Jumping into the West Michigan Health Careers Council, the council is one of 5 employer collaboratives led by West Michigan Works that encompass high demand industries across that 7-county region. And the mission of the council is to strengthen the West Michigan healthcare industry by identifying, developing, and promoting healthcare career opportunities. And we accomplish that mission through the 4 main strategies you can see on your screen. The first of those is outreach and promotion. It's working with employers and community partners to encourage careers in the healthcare space through career exploration and student engagement activities. So our big one here that you might have heard of is My Career Quest that we host in the spring every year. We're really excited to be back in person in that event for 2023. The second strategy there is the education and training piece. So that's working with the council to provide effective ways to enter into, learn, and be effective in the healthcare industry. We do this through defining career pathways throughout the industry and through a very big emphasis on apprenticeship programs in the healthcare space. That third strategy is centered around funding and resources, and it's just working to find the funding opportunities to support the efforts of some of those other strategies. And a big piece of that is through some of the grants that we'll actually be talking about today. That final strategy is focused around the retention aspect of the industry. So working to find ways to help healthcare employees stay both within their industry and within the current organizations that they're working at. So that's just a really high-level overview of West Michigan Works and of the West Michigan Health Careers Council. And with that, I'm going to pass you over to Tori for the even more exciting part of today's presentation. Tori, the stage is yours.
Thank you, Trevor. So good afternoon, everyone. My name is Tori Bohl, and I'm a business solutions representative for West Michigan Works. And I am excited to talk to you about the Going Pro Talent Fund. Some people here have gone through the Going Pro Talent Fund. Some people here might be new, but I'm excited to kind of give you a light overview to review what the Going Pro Talent Fund grant is. And then we're going to go into a panel discussion where we have amazing employers that will kind of talk to you about their tips about Going Pro Talent Fund. And then we have other grants. So Going Pro Talent Fund focuses on next year's. We have grants that will help you focus on what's going on right now with incumbent worker training and on-the-job training. And so to get started here, we have some proposed changes from the state of Michigan for Going Pro Talent Fund. It provides competitive awards to employers to assist in training, development, and retaining current and new employees. Training is supported by the Going Pro Talent Fund, expands and improves an employee's skill set, and develops their opportunities for growth promotion within the company. In short, Going Pro Talent Fund helps people upskill their existing or new employees so they don't fall out of demand and out of focus with what's going on with career advancements within healthcare. The new changes or proposed changes here is the third point here. Biannual application award cycles, only available online and vetted through West Michigan Works agencies, and there's going to be a tentative training dates of 12 months from the award date. The next proposed change here is for classroom training, new hires, and USDOL. Last year it was $1,500. Classroom may not exceed $2,000 per person. For the new employee on the job training will not exceed $2,000 per person. And for the US DOL will be $3,500 per person. Those are some great changes if they make it, but again, they're proposed right now. So going into the types of training wise for virtual training can be held if it's a course is instructor led, and as long as it's online and not at the trainee's own pace. The course must result in a credential or a specific customized short-term training skill. But things that are not allowed is soft skill training. So soft skill, implying that would be things like CPR trainings. That's not allowed. Consulting, seminars, conferences, workshops would not be allowed for Going Pro Talent Fund trainings. But while there is trainings that are not allowed, there are trainings that are allowed as well. And so leadership training for Going Pro Talent Fund. I put a star on leadership because it's not just a gentle ask of like, hey, I want to go to leadership. You have to give a little bit more information, kind of identifying at your company who are leaders, why you want to send them, trying to get that explanation of why they are leaders, and project management as well. You can send your company or your employees to project management training. Again, this one, you kind of have to go a little bit deeper into why you want to go to project management training. But as you see on here, this amazing list are trainings that individuals and employers have added on there. Dementia care specialist, dry needling, CNA, recovery coach specialist certifications. These are amazing trainings that people have done that shows it's not just CNA. So it's really taking that deep look within your company to say, what do we need? What do we want to advance or send our employees to? And how do we get those funds to do that? And the last one on here, apprenticeship training. I can't probably talk enough about apprenticeships, but we have our MA and surgical technologist for apprenticeship trainings, and we can also build an apprenticeship training just for your specific company as well. So Going Pro Talent Fund on the job training, going a little bit deeper into that one here. So new hires are employed in Michigan. They must be 18 years or older. Full-time is considered 32 hours, and the state of Michigan is full-time. And then again, reimbursed up to $2,000 per new hire following that retention period. So if they stay 90 days, you can get up to that $2,000 of retention. And of course, there's going to be additional incentives if they're part of a targeted population. Going into the US DOL Registered Apprenticeship a little bit deeper, reimbursement is up to $3,500 for each of the apprentices. This year, which is new, which is again proposed, is that's not just your first year. It can actually be your second, third, fourth year. You could apply on the application for Going Pro Talent Fund. That is amazing. Doing this for a while, and that's just a great thing to hear if they make those changes. It could be new employee or an existing employee, a part of the United States Department of Labor Registered Apprenticeship Program. And that's the combination of that classroom and on the job. You're taking both of those, and that makes the $3,500. I want to show this slide. So this just shows since 2018, what is the outlook with healthcare? So these are the 5 main industries that we have: healthcare, manufacturing, IT, construction, agribusiness, and other. And as you see here, back in 2018, we have just about 808,000 that was awarded for reimbursement. And now in 2022, we just had under 4.5 million reimbursed for Going Pro Talent Fund. That it's amazing. As you see, healthcare is growing. There's a lot of trainings. There's a lot of high need for healthcare. So I'm very excited. We have 3 amazing employers here that's going to talk about just their benefits and what they've been doing for Going Pro Talent Fund, their experiences. They're going to take about 5 minutes to kind of share those. Between these employers, we have employers that have done classroom training. We have some of these employers have done apprenticeship trainings, and they've done just new hires as well. So together, they're going to be able to explain the Going Pro Talent Fund at a much deeper level and how it's helped them out. So we have a chat feature. Trevor and Rochelle will be monitoring the chat. Feel free to answer or put your questions in there. We will answer them, and we also will have time for some questions afterwards. But I want to get started our employer discussion with Kelly Elkins from Trinity Health. We have Pam DeBono from Samaritas and Emily Babson from Mary Freemed. Kelly, I'll let you take it away. I'll pass it on to you to kind of talk about Going Pro Talent Fund and what it means to your company and what kind of tips you can give us.
Okay, sounds good. Thanks, Tori. And thank you for inviting us to speak today. So I'm Kelly Elkins. I'm a workforce development program partner with Trinity Health, and I support our ministries in Michigan, Florida, and Georgia, as well as our national programs. We have been participating in Going Pro Talent Fund since it was previously the Skilled Trades Training Fund back in 2016. So our strategy each year has been a little bit different, but throughout the last 7 years, we have done everything from new hire training, the classroom training, and then of course the apprenticeship. And really the apprenticeship is what got us involved. West Michigan Works had said when we were starting our MA apprenticeship in 2016, they're like, hey, we've got some funds to help you cover, this cost. And that kind of perked our ears up and got us going on this journey. And then every year our goal has been to build a bigger and bigger application, which is always fun on my part too. So in my role, I am actually the one that is writing the application, and I should say applications because we have 7 locations across the state. So I'm doing 7 applications every year. My one piece of advice would be that if you're an employer that has multiple locations and they're like we are in multiple counties under, multiple different Michigan Works agencies, it is easiest to identify one Michigan Works agency to be your kind of point agency and then have everything run through that one. So West Michigan Works has been a wonderful partner, and so we run all 7 of our applications and funds through West Michigan Works. It's just much easier than having 7 different people to talk to and report to. So that would be kind of my biggest piece of advice is if you have multiple locations, identify one agency to work with. Are there other specifics, Tori, that you want me to mention right now?
Oh, yeah, I think for one of them too, for apprenticeships, if you can just kind of expand a little bit on that one with how did you get that kind of started for getting leadership on board to say, hey, let's do an apprenticeship? How did you bring that up to management or leadership? Did you just kind of just say, hey, this is a grant, we're doing it? Or did you have a few conversations, or did you pull different teams together? How did that kind of look?
Yeah, good question. So our philosophy is always that when we are approaching a new workforce development program, like an apprenticeship or an on-the-job training that we're building, we're always asking for approval for the total cost as if we, Trinity Health, had to pay the entire tuition. But then knowing that we do want to apply for funds like Going Pro and other, external funding opportunities. But because they're not guaranteed funds, I never want to promise that we'll get them. So I always ask for approval for the whole cost and then go back to leadership and say, guess what? We were awarded Going Pro. And so $3,000 per apprentice has already been covered. So it's easier to go back and give them good news than bad news. So that's the approach that we're taking. We're not creating programs because of Going Pro. We're using Going Pro to support programs that are already in place or that we are starting.
Well, thank you for that. Yes, that is true. I know it's always better to give that good news to say, hey, we got awarded, so this can offset. I know another company too, Samaritas, Pam, she's going to speak next, and she has multiple locations as well. But can you talk about some classroom trainings that you put on your application and different things of how you built your application when you're writing things as well? As we know, Kelly will say as well, there is a process of filling out all 7 of those before that deadline. But Pam, if you want to just kind of speak and share your tips and information.
Sure, thank you. It's a real pleasure to be here with the healthcare group today. I am with Samaritas, and we're one of Michigan's largest nonprofit organizations outside the hospital systems. We have 1,200 full-time employees and another 200 to 300 part-time employees, and we are statewide. We do have one of our headquarters in Grand Rapids. So as Kelly mentioned, we do submit multiple applications, but it's been really a great process for us to use West Michigan Works as our hub to do that. This is only our 2nd year of Going Pro. We learned a lot from the first year. And for us, it's been incredibly helpful as a nonprofit because to provide classroom training, we either have to receive program contract bids or raise the money, the funding through philanthropy. So this grant was phenomenal for us. This year, we received the Going Pro grant to send 29 employees to 4 different classroom trainings. And just a comment that for us, most of those classes, not all of them, were online, which really helped us because there weren't any additional travel expenses, because the employer does have to pick up the travel expenses. The 4 classroom trainings, they were a variety of technical training and caregiving improvements that helped our service lines, and they were definitely skill upgrades for the employees. And I wanted to make sure that I highlighted an aspect of the Going Pro grant that's very, very helpful is the flexibility with classroom training. So a year ago, when we applied, we had identified one training that was called Healthy Families America. And it was for our foster care and family preservation staff who go into homes and help families. However, after we received our award, the Michigan Department of Health and Human Services, they delayed a business contract that would have used that particular training. But we were able to go back to West Michigan Works and swap out that training for another one called Mental Health Resiliency that helped our substance use disorder program instead. So that flexibility was really key for us, given the time delay between when we apply and when, as the year progresses. I did want to share our biggest success story. We were approved to send 6 caregivers from our senior living centers to dementia capable care training. And those classes cost $2,400 each. So Giving Pro going up to $2,000 next year, that's fantastic. The caregivers earned their dementia care specialist certificate from the trainer, and now they are capable of instructing other employees. So we have the trainer model going. The dementia capable care efforts, one of our strategic priorities, and we are fully implementing this in the Grand Rapids assisted living and memory care facilities. And this is a huge culture change for us, but thanks to Going Pro, we have more trained staff. And bottom line is our senior residents who live in the facilities, they're getting important health benefits. Over 90% of our residents with dementia are now maintaining their cognitive levels much longer, even with progressive diseases such as Alzheimer's. And really importantly, our caregivers are much more satisfied with their jobs. They feel less stress, they're more capable to give patient-centered care. And for us, this means less turnover and higher retention in an industry with really rough staff shortages right now. So in closing, I'm a grant writer for a living, but for those of you on the call, maybe you're from HR or the business owners, business leaders, please think of your application as crafting a compelling job description or a winning sales proposal. Bottom line, keep it brief and simple and really highlight what are the business benefits to your company and what are the benefits to your staff of the classroom training. Tori, do you have any follow-up questions or do you want to hold for the end?
We could hold to the end, but that was perfect. And I know that's amazing for those stories about how they have grown and upskilled. That is just fantastic what Going Pro Talent Fund has done. And I know Emily as well. This is your first year of doing the Registered Apprenticeship program, but you've been working with us on the Going Pro applications for a few different years now. Would you like to talk about your tips and information and how that's benefited Mary Freemed?
Yeah, Kelly and I go way back. We were the original STTF crew. So yeah, we have done it the past 5 years. I think there was a COVID year where the funding wasn't available, but we have received close over $500,000 over the course of those 5 years. I am not a grant writer. I have an HR background, but I will say that the team at West Michigan Works and the group that helps put this together, makes it very easy. The worksheets, the planning tools, all of that make it very easy. I think we give it, because of COVID, we are kind of at an advantage in this grant because I really played up like healthcare being really tapped, and we are high in recruitment and needing retention, and we don't always be in healthcare, and the government kind of dictates what we get paid sometimes. So having the funds available and the budget available to do continuing education and growth for our employees isn't always readily available. So being able to have, something that doesn't hit the bottom line, but the training available to grow staff and groom staff and to onboard new staff has pretty much saved us. And when I did the grant writing, I really played up to that. Like, if you want the Grand Rapids and the Michigan community to receive healthcare, we need to invest in our healthcare workers, and really played to, this is a team that's really been impacted by COVID. It was 2 months of feeling underprepared and overwhelmed. And we need to use these dollars to get our teams better prepared. So we've really utilized that. One thing that I think is confusing for people that I'll just mention is there are really 3 parts to this. Honestly, you can hire new employees and just have to show that they make it past their 90-day orientation, and you can get money for that. So we've used that money to help with preceptor programs, or for onboarding materials, or for various different things. We've helped use those dollars to offset their wages and to improve the hiring process. So that really helps with the new staff hiring. So you could, like Tori said, just do that one. Or you can do the classroom trainings. What I do for the classroom trainings is I created a Word document that has, criteria at the top, and then at the bottom it has the essentially an application. And I send that Word document out to all of our leaders, and I say, what are some key areas that your staff need certifications or credentials or upskilling in? And then they fill that out, and then they send them back to me. And since I've been doing this grant a while, I know the things that will get approved and not approved. And then I use all of that to kind of populate the grant features. So I have a full-time job outside of grant writing, so I don't have time to type that all up. So having the leaders actually put this into their own words, and I literally just copy and paste the information into the tool that they provide, it makes it a lot easier to use.
Yes, I'll agree with that. That tool is very beneficial to have. That copy and paste. I will say with this Going Pro Talent Fund, copy and paste is your friend, and save your application or write it separately so you don't lose everything when you're applying, when you paste it into the WeBloom system. But no, this has been very good information and very beneficial. Another piece of information too on top of that I'll kind of share is where I would start. If you're like, okay, I want to definitely apply for Going Pro Talent Fund, I would say the first step would be to go onto Pure Michigan Talent Connect and at least register and make sure you're all set there. For any grants that we're going to do for Going Pro or for others, you have to be on the PMTC. That's the first step, and then sit down and kind of figure out and plan what you want to do. On the next slide here, and we'll hold questions to the very end because I have a few other things. I'm sure there could be some questions for you, Emily, Pam, and Kelly. So I'm going to go on to how to do those next steps here. I apologize if I can click on the right spot here. There we go. So start thinking of your classroom training needs in different quotes. Like Emily said, they're going to your leadership team and telling them, hey, what do you want? What do you want to upskill? That's going to be very beneficial. One thing that we didn't talk about is thinking about your company as a whole. I know some of the employers here, they put IT as a training on there. I know one of the main rules is don't make your IT mad because they make our technology work. So what type of skills and certifications, even within your healthcare systems, do you have an IT department? If you do, what trainings do they need? Let's add it on the application. Let's make sure when we submit this to the state, we say, this is our company as a whole. These are the trainings that we need to upskill. And then the next one is talk about your hiring projections. You could do classroom training just by itself. You can do on the job, but even if it's 1 or 2, that's perfectly fine. If that's your hiring needs, you'll make the case on there. I know Pam was talking about that application process. You can say, yeah, I need 5 classroom trainings. I just only need 3 new hires. That's okay. And then West Michigan Works will be sending an information session. So like I said at the beginning, these are all proposed changes for the $2,000. I'm going to cross my fingers and I'm going to smile, especially if we get that $2,000. But if they do, that information session is going to be that next key thing that you want to be looking out for. That information session will go out. The state of Michigan will state a few things. They'll first state, yes, these are the proposed changes. We are accepting them. The second thing they'll tell you is when the application starts and when it will end. And then you'll be meeting with myself and we'll be sitting down one-on-one to kind of talk about, all right, what are your classroom training needs? What are your new hire needs? What are your apprenticeship needs? And we'll try to build the best application we can. Of course, there is going to be some other grants that are available. So as we're talking about for Going Pro Talent Fund grant, that's for your projections of next year. We have other grants that will look at what do you need right now. You probably could tell me, Tori, guess what? I needed someone yesterday, or I might be looking at someone walk out the door right now. I just need a new CNA right now. So these are grants that West Michigan Works offer. Going Pro Talent Fund, On the Job Training, and IWT are the other two that we offer that can help you right now. I'm going to kind of go into this one first, starting with On the Job Training. So on the job training, reimbursement for up to 50% of the new hires' wages. It's about 3 to 6 weeks. It's designed to offset the costs associated to training a new hire. 30 hours is considered full-time, and if they make more than $12.25 an hour, the individual must be eligible, and all the documents have to be completed before they start their first day of training. And then referrals can either come from the employer. So you can say, hey, Tori, I'm going to hire someone in about a week. Can you see if they qualify for OJT? Or at West Michigan Works, as Trevor stated at the beginning, we have a talent solutions division. They might have someone that's already pre-qualified. They applied for one of the employers, and where I'm reaching out to you to say, hey, I have someone that qualifies for OJT and they just applied at your company. Here's their information. If you hire them, let me know so we can get this reimbursement funds to help you out right now, right away. Of course, there's the exact same thing for incumbent worker training. Incumbent worker training is for that classroom piece. So again, if an employer says, yeah, I have some people that are sitting right next to me even, and they want to go to training right now, they don't want to wait until next year, that can help them get that certification. So the goal is to strengthen or maintain employment or enhance their urge waiting capacities. An employer reimbursement is 50% of the cost of training. Each company gets $25,000 or up to $25,000 of incumbent worker training per program year. The program year starts July 1st, ends June 30th, and usually resets after that one. So now it's of course available year round, and there's an application deadline each month. And the nice thing about the incumbent worker training, on the job training, you can use that alongside of Going Pro Talent Fund. So you can apply for Going Pro Talent Fund and you can use incumbent worker training. They don't mix, they don't cross, so we can definitely use those funds to help you out. More information on incumbent worker training. So the criteria, it's meant to be short term. Just like Going Pro Talent Fund, you must earn a certificate or credential. It must benefit the company and the employees. So I believe Babson brought up a very big portion of Going Pro Talent Fund, setting out that information of, hey, you want to go to this training, what's the benefit to you going to this training? And then the employer can write, okay, this is the benefit to me having this person being upskilled, putting those two pieces of information in the application, and then letting us know that you want to submit that. The training must be instructor-led training, and it has to be online or in person. Again, self-paced trainings are not allowed. But of course, I'm here. I'll work with you one-on-one. If you submit me a training, you can say, hey, Tori, I want to go to this training. Will it work? And I'll let you know if it work for incumbent worker. I'll let you know if it work for Going Pro Talent Fund, or we could work together to see what similar trainings out there that can help benefit to go to a similar one. Of course, there are rules of trainings that cannot be used. Training must not be for normal cost of doing business, CPR, first aid, leadership and management. So for incumbent worker training, leadership and management are not allowed. So we want to save those just for the Going Pro Talent Fund if we can. So the next one is here is questions. So I know we have a lot of different employers here. Feel free to ask any questions. Trevor or Rochelle, is there any questions in the chat, or is there anything else that anyone would like to know to ask our three employers that we have here just about Going Pro or any of the incumbent worker or on the job training? These employers have used those as well, so we can speak to them too.
Yeah, so there are a few questions in the chat. I did answer a couple of them. So starting with the ones that haven't been answered yet. Can you share more about customized apprenticeship opportunities? What is the criteria? Trevor, do you want to take this one?
Yeah, absolutely. So we have an apprenticeship team through West Michigan Works that kind of handles a lot of the apprenticeship process. To really boil it down into a 30-second response, we start by working with you to determine what kind of program you'd like to put together an apprenticeship for. Those all have to be registered through the U.S. Department of Labor. So once we've kind of determined what position or positions you're looking at, we'll do a look out into kind of the U.S. Department of Labor database to see if any kind of existing curriculum or program for that apprenticeship program exists. If it is, there's ways to kind of adapt that curriculum and get it added on as a local program in our region if it's not already. And if it isn't, then our apprenticeship team can help you to establish that program with the U.S. Department of Labor. So as a first step, if you're interested in looking at apprenticeship programs, I'd encourage you to reach out to me or Tori or someone at West Michigan Works, and we'll get you in touch with that apprenticeship team that can help get started with that process.
Thanks, Trevor. The next question says, must all of the funds go to the education providers, or is it possible to use some funds for payroll to cover the extra hours that hourly employees may spend in the educational program? So for Going Pro Talent Fund, there are those 3 buckets, one for classroom training, one for new hire, and one for apprentices. So within that classroom training, the $1,500 or now hopefully $2,000 is used to reimburse the cost of the actual training. There usually is a component of the application that is an employer contribution. So if you are paying your employees while they're in training, we consider that your contribution. And there's usually a place in the application where we would capture that. We don't have that information yet for this next year, but for example, last year, you got more points if you were at least a 1-to-1 ratio with your contribution, but you can't use that $2,000 to reimburse for the wages for the employees. It's specifically for the cost of the actual training.
Can I add to that real quick, Rochelle? So
Absolutely.
This is Emily from Mary Free Bed. Whenever you fill out the application, you will, for the new hire section, you'll list the potential hires that you're looking to make. I, in the past, have looked at the prior year, what was turnover, et cetera, and we make a list, right? And you put the name of the position, how much they make an hour, and their estimated training time. And so that's how they get the dollar amount for how much each role will be reimbursed. We have nursing orientation that lasts 6 weeks. So obviously that $2,000 doesn't cover all that training. But what we use those funds for is like preceptor pay or different things like that. And the nice thing about the new hires is that you can switch the people out. Like let's say you hire four nurses, but you planned on hiring 10 nurses. You can take those other 6 and trade them out for respiratory therapist or something like that. You don't need to have the exact position. You can trade those out. So that's what I think. Like if you know you're at least going to hire 50 people, put them on there. Then I kind of they just flip them out that way. But we use that those training dollars to help with preceptor pay and things like that.
Yeah, thank you, Emily. And just to clarify, what I was saying, that $2,000 would be reimbursed for classroom, that's just for that classroom portion. So like Emily was talking about that new hire section, and the whole intention is to get reimbursed to help offset the cost of training new hires, or, like Emily said, to be able to support, preceptors or other programs around your, training program with those new hires. But that category, they have to be new hires. So it's not, training an existing worker. The next question says, where can we access the application? I'm not sure which grant this was referring to, so I'll just run through really quickly for each of them. So for Going Pro Talent Fund, each employer that wants to apply has to do that through their local Michigan Works agency. So for our area, it's us, West Michigan Works. And we will be communicating when the info session is, which is really where you get all of those nitty-gritty details about the program year and the process. And then once the application does open, that would be, it's through an online portal, but it will be through West Michigan Works. So we will help you make sure you know all of the ins and outs of the application. We review it, and then it actually gets submitted on your behalf by us. For incumbent worker training and on-the-job training, those applications are available through West Michigan Works. Most of you probably would work with Tori, but you can reach out to Tori or Trevor, and if it's not one of them, they will make sure to get you connected to the business solutions representative that can help you. So the applications are available through us. Next question is, if it is a biannual application award, is this an application year, or is it just that we cannot be awarded 2 years in a row? So I will answer this question from what we know right now. However, I will, put a little caveat in there that we have not received all of the details from the state. But what they're talking about is doing 2 application cycles a year, and then each employer would only be able to apply once within that grant year. So for 2023, there would be 2 opportunities to apply. You can only be awarded one of those. And then the training dates would be 1 year from the award date. So let's say you apply at the first one and it's a typical January through December. You apply, you get awarded, you use, you have that year. But let's say for whatever reason you waited and did the second application cycle, then you would have a year from that award date. Where it gets a little tricky and we don't have all of the information is in the past they have talked about putting a cutoff date as to when you would have to have your funds utilized in order to be able to apply for the next year. So we are hoping we will have all of those details from the state very soon, but that's kind of what we know right now. That is all of the questions in the chat right now. I will just review real quickly. Earlier, somebody had asked what the process was to get approved as an eligible instructor or training provider for Going Pro. And just a note there, the employers are responsible for identifying their own training needs and selecting a third-party training provider that meets that need. And then each training is reviewed as a part of the employer's application to determine if the training is eligible. So there's not a process or a need for each training provider to be pre-approved, if you will. And again, the employer is working with the local Michigan Works agency, which for us, West Michigan Works, we have multiple people that work with employers to help them with the application, review each of the trainings, review the application. Again, like Tori said, our goal is really to help you get the best application submitted that we possibly can.
I have a question. Emily touched on it very briefly, but I was just wondering if anyone wanted to elaborate. One of the really common pieces of feedback we get from employers is the difficulty of having to project people they want to send to trainings and the number and quantities of new positions they're going to hire a year in advance, because you really need to have those numbers for the entire calendar year, in that September, October, November range when the grant application opens. So I wonder if any of our employer experts on the call have any tips or tricks on how you try to accurately project those new hire numbers and those classroom training numbers that far in advance.
This is Pam from Samaritas. I can speak to the classroom training piece. And again, there's great flexibility. You do have to include names of staff in the training plan for the classroom training section, and their hire dates and their current wages per hour. But wow, we found that if for some reason, as we got closer to the trainings, we needed to send other people, we had the ability to swap out those names. So they weren't locked in stone. And I just wanted to add, the company does have to pay for the training And this is done, and then the grant works on a reimbursement basis. So just know there is a step there where you have to show a paid invoice for the classroom training, and then you submit that. And I do want to say this year the reimbursement process has been really smooth for us. Amanda, our contact in West Michigan Works, every month she sends me a list going back to the training plan, and she just details, this is what you said you were going to do. Is that date still valid for those classroom trainings? These are the people. Has anybody changed? And I can then gather the information and submit to her the documents, and she handles the reimbursements. So it's a really good, smooth process for getting paid back.
This is Kelly. I can speak to it, and I will be completely transparent and say this is something that we have struggled with and don't have a great system down pat. And part of it, I think, is just being such a large system, and there is a lot going on all the time, that we're working on a rolling basis on workforce programs. And so there are times that I just don't know what's going to happen in FY23 yet. So we're still trying to figure out the best way to go about it. Like Pam said, this is a reimbursement. So we as the employer have to pay the invoice up front and wait for that reimbursement. With Trinity Health, we don't do a lot of trainings that way. Most of the trainings that our staff need, we're doing that all internally with our education departments. So we're having to think about how to do it differently. I will say too, this can't be used to fund your tuition reimbursement funds. So this is not a grant that you can say, okay, yeah, I'll use this to cover our tuition reimbursement dollars that we're giving our colleagues. So it can't be used that way. So it is a process that we're still trying to figure out as well. But as we've been going, I kind of have a list too of different programs that if we were running on a cohort basis, I'll kind of keep a list throughout the year and say, okay, so for next year, do we predict another cohort of 2 of this specific training, and then make sure I put that on the app.
Another thing that we do at Mary Free Bed is we look at I regroup with our recruitment team when I go to apply for this, and I say, okay, well, has there been any positions that have been hard to fill over the last years because it was hard to find people with that credential or that certification or whatever that might be. So for classroom trainings, I will, let's say it's a medical or a medical assistant. We had that for a while. So then that's why we decided to go through the medical apprenticeship program. We've had it where we haven't had a lot of CNAs come. We've had people with good soft skills, but they don't have the CNA certification. So I meet with my recruitment team as well to say, hey, can we upskill some current employees? What are those skills that are lacking? And then I put those ones on my training plan to upskill existing employees. And then I mentioned before with the new hires, I just look at the turnover from last year. Like if I had a turnover rate of 20% nurses, then I'm gonna say I'm gonna hire 15% or of our workforce. So I think looking at your turnover from the prior year and to see what the needs are, saying like maybe you did, we did 1,200 outside hires last year. I know like I can easily get 50 of them to stay 90 days. Right. So I put 50 on my plan. So don't overthink it. Like just do a reasonable amount of if you decide to do the new hires, just put them on there.
I just wanted to add for our new hires, we have a lot of different service lines and all different job titles, but we kind of tried to categorize them. So we had a direct care worker that does many specific functions in different service lines, but we lump those together because it's a similar pay level. It's a similar experience, at least in the onboarding. So we were able to lump together some specific job roles. So that might be a way also to make it a little simpler when you fill out your training plan to think that way.
I'll kind of jump into for the training plan. We work together as well. So when you're filling that out, I know especially for the bigger companies, putting down every single job position might be time consuming and title. So if you want to group them, I don't think putting like 150 different job title names might be a little bit hard. So group them. I think I'm going to hire 25 RNs. I think I'm going to hire 10 CNAs. This is the cost they're at. And like we said before, Amanda and everyone will work with you once it's been approved, going back to say, all right, now who did you hire? And let's match that up. Another big piece of this too is just saying the fact that we're not coming after you if you don't. So if you're like, okay, I'm going to put 10 and all of a sudden I only hired 8, am I due this money back? Do they all of a sudden they're going to come after me? I promise Trevor and I and Rochelle will not be coming out knocking at your door saying, hey, you didn't hire 2 new hires. It's reimbursement. When you look to apply next year again, or that second term, if they do the 2 different ones for the years, how they go, it'll be by utilization rate. So we like to be at about 90% utilization rate. And so if you put 10 new hires, let's say you're just doing it, you hire 8. Of course, I will be there. Trevor will be there. We'll try to help you do as many things that we can to get you those 2 more new hires so you can get the max amount. But if it doesn't happen, it's not the end of the world. We will work with you and you can still get reimbursed. So I know that can be a deterrent, thinking, oh my gosh, if I don't get it, what happens? It's okay. We will guide you through that whole process of it. Rochelle, did any more questions come in?
No.
Well, I would like to first thank our employer panel here. It was amazing information. I cannot wait. Thank you, Emily, Kelly, and Pam for being here. I'm going to provide my contact information here as well, just so you have it. But I want to thank everyone for attending. Of course, reach out after this one. I'm going to email everyone the PowerPoint slides just so you can review it. I also have a list of last year's approved and not approved trainings. It's more of extensive for all different industries, not just healthcare specific. That might be helpful and useful as well. And I'll include that on there. And then I'll also include my Calendly link. At any point in time, if you're like, hey, I want to talk more about one of the 3 categories of on-the-job training, the classroom training, or apprenticeships, feel free to just schedule a time to meet with me. If you want to just say, I want to talk with you, that's all right too. That you just click on the Calendly link, schedule a time, and I'll meet with you. But I thank you so much for coming and attending our West Michigan Works Lunch and Learn.
And I'll just quickly add that this meeting was recorded, so I will follow up with an email as well with a recording of this, so all this information can be available to you on demand and in perpetuity. Thanks all. Hope you have a great rest of your day.